Hi, we are going to talk about surgery. Well, general surgery is a medical specialty that includes the diagnosis and treatment of diseases that are resolved by surgical or potentially surgical procedures, both elective and emergency, of the following devices like digestive, endocrine, breast, skin, abdomen, and retroperitoneum. Likewise, the general surgeon must also resolve the emergencies of some pathologies of surgical specialties, such as vascular and thorax, in order to initiate treatment, stabilize, and transfer the patient to a center of greater complexity.
Okay, so life as a surgery. Imagine life as a surgery. Each day we stand in an operation room facing with decisions that require precision, care, and a steady hand. They felt very conflict because they have a lot of work and they have the opportunity to make a real difference in the lives of their patients. You can expect to work in areas such as the operation room, where you will perform surgeries ranging from routine procedure to complex, life-saving operation. This includes preoperative planning, pre-stage execution during surgery, and post-operative care.
How much can you earn as a surgeon? Well, it depends on the subspecialty that you want to work, but as a general surgeon per month, it depends on the place you work or institution. For example, in IMSS you can earn 30,000 pesos, but in ISTE you can earn just 18,000. The institution that pay the most is Pemex with 41,000 per month. Also, the specialties that give you more money is the plastic surgery and neurosurgery.
And how about the benefits? Well, studying to become a surgeon is an excellent option if you want to contribute to improving people's health, provide help and receive a good salary for it, feel useful to society, or you can work as a scientific researcher. The benefits of being a surgeon are wide and varied, and some of them are to receive a good salary, find a job, choosing which sector to work, continue with your professional development for the rest of your life, and acquire respect and prestige in society. More examples are that it is a well paid career, it is a very rewarding job, it allows you constant development, it allows you to work flexibility, and you can choose the place, for example, the city or the country, to practice your residence.
Being a doctor requires certain levels of skills, like empathy and compassion to understand the patient's feelings. You need to know how to analyze every detail in a patient or like lab test. They have to be emotional intelligence, and they also know how to solve a problem in a very short amount of time, like in emergency or something like that. And of course, they have to be resilience because this is not an easy career, so they need to be mentally and emotionally strong.
The entry requirements to be a doctor, we can divide it by steps. The step one could be that you have to complete the master or the degree of medical surgeon because you need to know all the basics, like signatures and all the things that you have to know to be a doctor before you can be in a surgery or before you can touch a patient. The step two is if you are lucky to be in the resident, you must know a doctor to learn all about the things they know. For example, if you are in the hospital, you have to know or you have to meet some doctors to learn from them, and you can practice and you can go to surgeries. So you have to know some doctors that are very good and very expertise in the area. And the final step is finally you have to be patient because this trip that you are going to take is too long. You have to be patient, you have to study, you have to really love the thing that you are going to do and really love the thing that you are doing during the residence center and the student's life. You have to really love and be really passionate about the career and help people. Also, we have to know how to become a surgeon. First of all, you have to know that it is going to be a long trip. Really long trip, because you are going to spend a lot of time and a lot of years of your life studying, seeing patients, and being in hospital. You are going to stay more time in the hospital than in your house. So, first of all, you have to finish the medicine career, because you have to know all the basic things and you have to be know all the things that you can apply to the patient. Second, you have to do the internship. This year where you have to stay in the hospital and you're not going to see your family 2 days in a week. So you have to do this year, and here you're going to learn a lot of things about the medicine and a lot of things about the specialty. Then you must do the social service. This is another year where you are going to work in I don't know if it's free, but you have to work to be to the patients in another part of the city or in another state. Then you must study to the norm. This is the exam where you can apply to be a resident in the surgeon's specialty. You have to pass it, and you have to go to the hospital to see if they can take you. If you're lucky to find a hospital where you can do the residence, then you will have to finish all 4 years of the residence. These all 4 years are going to only focus on the specialty, and you are going to stay in the hospital again, but in another step. And finally, if you pass all these steps, you are going to be a surgeon. Congratulations, and if you are thinking to be a surgeon, you also think that it is going to be a long trip.
And where a career as surgeon can take you? Well, it allows you to publish articles on different surgical approaches or new diseases. Also, it allows you to teach students and share your knowledge and to publish articles on different surgical approaches or new diseases. And also, you can travel to other countries and participate in different congresses.
Well, I want to tell you that if you're a surgeon, you have a lot of opportunities and options to become a subspecialist. Here, I put you a list of the most required subspecialties in surgery talking about an arm. First, we have orthopedic surgery, cardiothoracic surgery, and plastic surgery in the top 3. But as I told you, there are a lot of options. We can imagine about pediatric surgery, we can talk about hepatic surgery, we can talk about neck surgery, ophthalmic surgery, abdominal surgery.
A hospital has to provide a lot of medical service. That's why it has a lot of rooms, like a nurse room, a pharmacy room to provide medicine, a waiting room to the patients, a consulting room so the doctor and the patient can interact and talk about the diagnosis, and of course an operating room so they can do all these surgical procedures.
Other topic to talk about surgery is after surgery, there are several risks to be aware of in hospital. One of the most serious risks is receiving the wrong medication or an incorrect dosage, which can have a significant consequence. It is crucial to ask questions and understand the goal of your surgery, including whatever it will cure your condition completely or just manage the symptoms.
And well, with this, we are done with our presentation. Thank you for your attention.